what is iron? Iron is one of the most important elements that you need for life. You need iron to carry oxygen, and you need iron to do a lot of enzymatic reactions in the body. Basically, you need iron. It's like oil in your car. You need it.
Hey guys, welcome to another edition of Beyond Biohacking Brothers, where I'm joined by my usual brothers, Miguel and Rudy. And today we wanted to bring you a topic that a lot of people are suffering from and they have no idea. Dr. Rudy is obsessed with this subject. I've learned a ton through him about this subject, and it's incredible to see it in practice. But iron overload. I mean, you've done a ton of research on this, read a ton of books, interviewed a ton of people. You even speak around the country about this. So just let's delve right into it. What is the issue with iron? What should I be worried about? And tell me what's going on with iron.
Yeah, man. So, this is my passion, and we're going to try to keep it light.
Oh, exactly.
We're going to try to make it very simple and very practical for our readers, for our listeners, because it can get complicated.
Yeah.
So what is iron? Iron is one of the most important elements that you need for life. You need iron to carry oxygen, and you need iron to do a lot of enzymatic reactions in the body. Basically, you need iron. It's like oil in your car. You need it. So, but like everything in life, too little is not good, too bad is not good. So we always talk, when we think about iron, it's iron deficiency. Low iron causing anemia, causing you to be fatigued. It's a significant problem that affects almost 15% of the population, if not more, especially for women. When
Worldwide population?
Worldwide. Sometimes they say even more, and especially in countries where they don't eat a lot of meat, where there's not a lot of iron. You have iron deficiency anemia. And iron deficiency anemia in pregnant women is bad because your baby needs iron. And then if the woman doesn't have enough iron, the baby's going to have stunted growth, developmental retardation, a lot of things.
Maybe I was on that spectrum because my mom had that.
I think both of you needed to eat more iron.
One had too much iron, the other one didn't have iron.
So definitely.
But do women have to supplement with iron when they're pregnant?
Well,
is it important? Okay.
Yes. Most likely, depending on how much they eat. So following your iron, by the time we finish this, iron should be part of your every time you go and do a blood test. You should monitor your iron.
Just iron or ferritin with the
so
TIV?
we'll go over this.
And just to be clear, because of what you said. So here's why this is important, because most labs, most doctors will not test for iron or ferritin, which we'll get into as well, on your follow-up or on your yearly, physical or whatever. They will not test for it.
For example, a pregnant woman will have, when they go to their gynecologist, they will check their iron because they know that's a population at risk.
But for women.
Women. A woman who has heavy period, their doctor will check iron. But for the average person, a postmenopausal woman, men, unless they have significant bleeding, they don't test iron because men tend not to suffer from iron deficiency anemia.
So as you said, you say perfectly, we have a Popeye's effect, like we have a bias with men with iron.
In general, in our population, in our society, we have a bias for iron, the Popeye effect. We think Popeye ate spinach, got iron, got big muscle, which iron does help with muscle development. And then we always say, I'm tired, take more iron. You want more muscle? Take more iron. But what people don't talk about is that when you take in iron, we don't have no physiological way to get rid of it. So once you take it in, it stays in. And as we age, it accumulates. And the danger of iron is high iron times the time that you have high iron. That's why young people don't suffer from high iron. 30s, 40s, unless you have a genetic condition, hemochromatosis. But most people start having problems with accumulation of iron in their late 50s, 60s, and 70s, because it's those times.
Where do you get the most iron from?
So most iron comes from our diet. Again, our ancestors,
like meat, fish,
our ancestors grew in an iron-poor environment. It's really difficult to get iron. So usually you get your iron mostly from heme iron that comes from animal protein. Red meat being the one that has the most. Chicken and fish have a little bit. Then you have the non-heme iron that comes from vegetables, like lentils, spinach. Less absorbable than heme iron, but that tends to be where we get it. But you have to remember, I did that in my presentation, only 2% of the iron we need needs to come from our diet. So most of our iron comes from the recycling of our red cells. So we don't need that much iron, especially if you're not losing blood. Right. So women, when they're menstruating, need more iron. They need about their RDA required daily allowance is about, I think, 18 milligrams for women who's menstruating. It's 20 plus
18 and
for
9
pregnant.
for men. It's almost
But for men, it's 8 milligrams.
Yeah, sorry, 8
And
milligrams.
postmenopausal women, only 8 milligrams. A bowl of cereal, because in this country, the FDA added iron, inorganic iron in everything that has flour, rice, and everything almost carbohydrates.
Yeah.
So we get a bowl of cereal has 12 grams of
Yeah,
glucose.
no, you from your presentation, remember a protein bar has roughly 18 milligrams.
Yes.
I'm a good student.
You're a good
Cereal,
student,
6
man.
milligrams. And what you said, you don't just consume one serving. You consume 2 or 3.
Yeah, at least.
And then one piece of bread, what was it? 6 milligrams. And you don't need one bread. I do 3 stacks.
Three
so
stacks.
I get
So,
18 milligrams.
And you take a central
And
vitamin.
just so to give you perspective, a piece of 6-ounce steak has 3 milligrams.
3 milligrams. So,
Which is crazy.
But it's
Wait, you do
readily
3 breads?
absorbable.
That's not part of Popeye's stack.
It's only when I'm hungry.
So again, when you talk about those numbers, you realize, oh wow, yeah, it's easy to take too much iron than you need.
Yeah.
But in our mind, you're like, that's fine. I need the more iron, the better.
Wait,
That's
so
what
if
we
I
think.
so just so I understand, so we need iron, right? But it accumulates over time because, for example, for women who are menstruated, they lose blood through their menstrual cycle,
Yeah.
right? They lose their blood. Men, however,
And sorry, they lose blood, which means the iron
Yeah,
is
they-
mostly
right,
Your
right.
natural phlebotomy, therapeutic phlebotomy.
no, but
donation.
for us guys, we basically have it's a bioaccumulative toxin at the same time. So it's a necessary element for life, but too much of it, like you said, becomes a bioaccumulative toxin, and we cannot excrete it. We can't sweat it out. We can't poo it out. We can't pee it out. So it accumulates over time, and this is where the damage comes.
And it's almost like a savings account that you put money in, and then now, it's like compound interest. And in the beginning, it's small, but as you put more money, you don't take anything out. After 20 or 30 years, you have a lot of money in there. It's the same thing as iron. After 20, 30, 40 years of eating the standard American diet that provides about 20 to 25 milligrams of iron per day, you can imagine when you're 50, 60 years old, you have all this iron that's now depositing into your tissues.
Well, I think you have a
So
great.
wait, hold on. Where do you see mostly what age category are you seeing? Because I didn't know that. Well, I knew that it's accumulated, but I didn't think, with the years it accumulated. So as a doctor, what age category are you seeing is the most concentrated amount of patients with high iron?
And aging. So unless you have a few things, a genetic condition that makes you accumulate iron, if you use steroids, including testosterone and steroids, because they promote growth, anything that promotes growth helps your body absorb iron more.
Wow.
Growth hormone, testosterone, steroids, all of those things make you accumulate more iron. But we tend not to see unless you have a genetic condition in the young population. It's as you age. That's why, to me, you cannot talk about anti-aging protocol without
the
talking
iron.
about an iron management protocol.
But what I mean, do you see anybody in their mostly in 50s, 60s, or it just
Yeah.
depends if they were on testosterone for years or
Mostly older age, unless I've seen younger people with hereditary hemochromatosis, which we'll talk
Now, for the average listener, you have a great visual, and this is where I was like, "Oh shit!" And I'm going to let you say it. How you should think about iron.
And it is very simple. We all know if we leave something, a metal, outside, it rust.
Yes.
The iron rust.
Yes.
Inside of our cell, rust.
Yes.
If we have too much iron. It's that simple. Just try to think about your nice little cell, your nerve cells, your heart cells, your muscle cells that
Rusting.
are nice and healthy. It has too much iron and it starts rusting.
what is it again? Iron never sleeps and rust.
No. Let him say it. Come
Oh,
on.
yeah.
If you don't say
Oh,
it,
I
I'm
don't
gonna
know.
say
I
it.
was gonna say it.
That's from Neil Young. That's
Rust
from-
never sleep and iron never rests.
No.
What did it again?
Go ahead, Carlos. Say it for me.
It's so. This is for you, listener. This is how you got to think about iron, because oxidative stress is just a fancy scientific word for rust, and that's what iron causes when you have too much of it in the body. It's oxidative stress. So rust in your cells. So iron rusts everything, and Russ never sleeps. And that is so true, man.
It's a song from Neil Young, and Neil Young is not a clinician. He was just saying that.
Yeah.
But I like to use that because people need to realize that we need to move away from that blindness on iron that we have.
Yeah.
Yes, for the people out there suffering from low iron, which there's a lot of them, mostly women, yes, we need to talk about this. We need to treat this, but we need to start talking about iron overload in the later years, because we're going to go over the studies that shows that ferritin, which is the stored iron, is directly correlated with longevity.
Yeah.
And we're longevity practice.
And before you continue, Doug, I wanted to bring one of your slides again. All the stuff that I'm getting from your slides. Dr. Jim Moon, the PhD, which was about chemical toxicologist. So for you listeners, this is a statement that he said: iron excess is responsible for more sickness and death in North America than any other single factor, including cigarette smoking. Is this one of the things that led you to spark the
So
bulb?
this is not from me. This is from a PhD with 20 plus years of experience in toxicology. Because the thing with high iron, you don't have symptoms from it. So now we see that. So we started checking ferritin level. We'll go over, well, let me go over it really quick. The way you check your iron, you need to do a blood test, and it doesn't go in your regular yearly blood test. And there's different things you need to check. One blood test contains the total iron, what is called your TIBC, total iron binding capacity, and it has your iron saturation. That one panel has 3. The second panel is a ferritin. You need those 2 things to see what your iron stores are. And of course, you need your CBC to look at your hemoglobin to see if the low iron is causing a low blood count, anemia. So again, anybody listening, what is your ferritin level? It's that question.
Yeah.
You should know. And
Yeah, you should know, like, you know your hemoglobin A1C.
Ferritin, sort of the captain sitting at the top. That
it's not a perfect blood test, but it is the most accurate that we have right now. So ferritin, what's bad with ferritin, it's also what we call an acute phase reactant, meaning that if you have any kind of inflammation, if you have lupus, you have cancer, you have rheumatoid arthritis, your ferritin will be high. If you have obesity, prediabetes, your ferritin will be high because it's just inflammation. So a high ferritin doesn't necessarily mean you have high iron, but wouldn't you know if you have inflammation? All we talk about is inflammation. So I see a lot of people who will get hung up on a cholesterol of 220. Doc, I'm so worried about my cholesterol. I'm like, do you know your ferritin level? No. I'm like, that's more important for your longevity because, again, remember that study that we talked about, the Copenhagen Heart Study. They followed 9,000 patients over 20 plus years. 23 years, about 6,000 of them died. And then they say, okay, what's the one blood test that correlated with longevity the closest? And it was ferritin.
Yeah.
And then, Miguel, I'm going to let you say it. Ferritin level above 600 was associated with a median half of 55.
55.
So if you have
55 years old.
And if you have between 200 and 400, which is where we see most of our
patients. Let me try, Doc. Let me try.
Give them the stats, Miguel.
600, okay?
Well, again, for
600, if above 600, average person lived 55 years of age. If you're between 399 to 400 to 599, you live on an average 72 years of age. 200 to 399, 74 years of age, 76 years of age. And then under 200, 79 years. So that's either 17 years, 21, or 24 years.
Which is really funny because
crazy.
the CDC, it matches the CDC's life expectancy of 78 to 79 years old. And as Miguel was saying, anybody who had unmitigated ferritin over the 100 mark, where we like to see it, or under 200, right, which is what 90% of our patients come in at, and it matches the life expectancy of. So this study, the Copenhagen study, is an amazing study. And like Doc was saying, one number, I mean, we all are obsessed with our cholesterol number. Like most of us know our cholesterol number. We may know our glucose level. Some will know their A1C level if they're proficient enough. But one of the big ones that should be on top there should be ferritin, that you should know your ferritin number. Now, I don't want to rabbit hole on this, but I think it was really fascinating. And, we ask every doctor that we interview, hey, how did you discover this? I thought it was fascinating how you discovered this, because we had been treating men with testosterone for many, 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 many years. And, one of the biases, or not the biases, but one of the common practices in the industry was over phlebotomizing.
Yes.
Like we were so concerned with hemoglobin and hematocrit going up, meaning your blood thickness wouldn't increase. And we're so, focused on heart health that most of us in the industry were like, hey, you got to do blood donations because you want to lower your hemoglobin and your hematocrit. Your experience was, man, these guys are over donating because they feel bad. I should start checking iron. And all of a sudden we included iron into our labs, and you found the other opposite of the spectrum, which is ton of people walking around with iron overload. They don't even know it.
Yeah. So
and a lot of the symptoms. Can you talk a lot about the symptoms
Completely.
that are tied to iron overload?
So the testosterone replacement therapy, our world doesn't like me talking about this because there's two camps in the testosterone replacement world. There's doctors who really just tell people, if you want testosterone, just donate blood every 3 months, just because you're going to have a heart attack.
we see that a lot.
That's bad.
Yeah.
That's bad advice.
Yeah.
So what we started doing about 2.5, 3 years ago, I started checking ferritin and all the iron parameters, and we saw a lot of patients who were over donating. Their ferritin was low, below 30.
Yeah.
Normal ferritin on Quest Labs is 30 to 400, really bad. But anyway, it was below 30. And those patients would come to me. They're like, Doc, I'm on testosterone. I feel horrible. Give me more testosterone. I'm like, no, stop giving blood. Let's put you on some liver tablets. Let's build back your iron. You don't need more testosterone.
Liver tablets to build up their iron.
Right. So I found those patients and I was able to tell them that. But then all of a sudden, I was seeing people with ferritin of 600, 800, 1,000 plus.
Yeah.
And I was like, what's going on?
Yeah.
And then that's when I discovered that a lot of patients have a genetic mutation where their body retains iron more. It actually, if you have Northern European descent, meaning if your parents are Irish, Scottish, from England, or not Europe in general,
suspect.
you have almost a 10 up to 30% chance of having one or two of those genes. Wow. And our body retains iron. Maybe when you're young, it's not a problem, but as you age, you accumulate that iron. And going over those ferritin levels. So if you're somebody listening to this, go and check your labs. Did they ever check your ferritin? If they did, are you at 600? Your average life expectancy is 55. I'm not saying you're going to die at 55, but what it's saying is half of people, 50% of the people with a ferritin above 600 died at 55.
No, it's great. And just 1 second, Miguel, because I want to follow that train of thought for a second. What was really like breathtaking to me is, again, we're talking about oxidative stress. We're talking about rust. And one of the things that iron overload does is permanent damage to the pituitary gland.
Yes, so that's another thing that I was saying. So first, iron overload usually don't have any significant outward symptoms of it.
Right.
But the 3 most common symptoms you see with people with high iron, number 1, chronic fatigue, feeling tired. 87% of patients have this.
Wow.
Number 2 is joint pains, sore joints.
Yeah.
Number 3 is brain fog. How many of those patients do we see in our practice?
Again, what was the first one?
Chronic fatigue, joint pain, and brain fog. Yeah. So those are very non-specific symptoms. That could be low testosterone.
Yeah.
But then I went further, and I'm like, how come I'm seeing so many patients with high iron and low testosterone? Actually, high iron is a cause of secondary hypogonadism. So everybody, go and look at this. Wow. A cause of secondary hypogonadism, meaning your pituitary not producing enough.
Hypogonadism being low T.
Low T.
Right.
So one cause of low T is high iron.
Right.
So I've seen maybe 8 or 10 patients in their 20s who came with low T symptoms who had a ferritin above 1,000.
Yeah.
What their underlying pathophysiological mechanism for low T, what caused their low T was high iron. Because again, there's an amazing study, and we'll put that at the end, that they showed that iron starts depositing specifically in the pituitary. We're not sure why, but it deposits in the pituitary, and then when it deposits long enough, it causes fibrosis of the pituitary.
Wow.
So it causes low T, and at one time, it becomes irreversible.
Which dysregulates all your hormones.
And then so now you have a cascade of abnormal hormones because of the high iron. Incredible. And here's the kicker. As I was saying before, taking steroids, any kind of steroids, including testosterone, increases your iron absorption.
Right.
So think about an 18-year-old who went, and on TikTok now, there's a trend to take Trenbolone and to take all of those anabolic steroids, and they take a lot of iron. Yes, you increase your iron. Yes, you will get gains. You'll get bigger muscles. But think about all this iron depositing in the pituitary. Yeah. And there are studies, we've seen that, right? Guys who use a lot of anabolic steroids in their youth, by 30, we said they fried their pituitary and they need testosterone.
Yeah.
It's the iron that's depositing, causing fibrosis. So the way they discovered that, even an MRI cannot show you that.
Right.
It was on postmortem, on autopsy, that they looked at patients, and they're like, from the age of 30, iron starts depositing in the pituitary. And the higher iron, the higher the fibrosis and poor function of the pituitary.
That's incredible. So, you know,
Wait, hold on.
I'm sorry.
You keep cutting me off. Shit, this guy was fucking hogs the mic, bro. I'm gonna start shutting him down. Like, yo, stop. I want to talk now. Damn. So, I'm still a little confused. Maybe we can do it off camera, but again, ferritin is the most important marker because, as we see, you can extend your life 24 years. But then TIBC is the saturation and the amount of iron that your body has, right? Which we're not going to get into the parameters, but you measure it all together because ferritin is a deposition of iron in the tissues. And then the iron, too much of it, is what's causing the oxidation, damage to the pituitary gland, fatigue, all of this stuff. Okay. Got it.
So, and it's not, it is a little complicated. And I've seen many times somebody comes with me and then I see an iron saturation. This is how much iron is in your blood. It should be less than 45%. And I see that 60%.
And that's not the regular. Like you're on the lower spectrum. Like there's spectrum that go like to 55 and you like to see it below that, right?
Because the definition of hemochromatosis, iron overload genetically, is iron saturation of 45%. But it can be influenced by how much you eat, iron you eat. So if the night before you had a big steak, so the next day you'll see
what I don't
iron.
get. How could it be, if it's an accumulative agent, how could it go up high one day and then drop
It does,
back?
because the blood test
Or
we have
the
on our
body
birth-
holds onto it and then some it dumps, but the most
we don't
know. We don't know.
So
you're
I
only
understand.
recycling. You said 2%.
Yeah.
No.
But here's what I'm going to tell you. You're trying to understand something that's imperfect. The best way to know if you have iron overload is to do an MRI of your liver see that's the gold standard. So those blood tests are not perfect. That's why you need a doctor who's experienced that can be. So I've seen patients who come high iron saturation, low TIBC, medium ferritin. We repeat, things are normal. So I understand your question. I don't have one single
I got you. But
The
there
answer is
are
I look at all
indicators
this.
to, hey, you are suspect of familial
But-
physiological familial hemochromatosis. Go check yourself.
But on that point, so I wanted to kind of close the loop on that. So just like you should be concerned, or you should pay attention, not that you should be concerned, but you should pay attention to your hemoglobin and hematocrit, because like, for example, if you're on hormone replacement, specifically testosterone, you will get something that's called hormone-induced secondary erythrocytosis, which is a thickening of the blood. And you know, one of the solutions is donating blood. But equally important, I think, is focusing on iron, because when you're on testosterone, maybe you can explain that a little bit, testosterone downregulates the hormone.
We don't want to go that
hepcidin,
deep.
but it'll give you physiological hemochromatosis.
We don't want to go that deep. That's really like the molecular biology of iron overload that our patients, there's a molecule called hepcidin that is the valve of iron absorption. So when you have high iron, you have high hepcidin. So it closes the valve. You absorb less.
Like the thermostat, as
Yeah,
you've
just
explained.
thermostat.
If it's too low, it
Exactly.
intakes more. If it's too high, it
tells you to
repulses
stop.
the rest.
And then testosterone does affect that. So when you take testosterone, your body keeps absorbing iron, even if you have
the
high
familial
levels.
hemochromatosis.
But you know, I'm going to go again and talk about patients on testosterone. If you have high hemoglobin hematocrit, there's no studies that have shown definitely that this can cause a heart attack or is dangerous for you.
Correct.
But
Which
you
is
can
why
have
the
symptoms.
industry kind of demonizes it.
So there's two camps. One that says donate every 3 months. One that says it doesn't matter what your levels are. Just don't pay attention.
Right.
I'm in the middle.
Yeah.
And then I look at those levels. Then I go deeper. I look at the ferritin and the iron saturation. If you have a high hemoglobin, high hematocrit, and you have high iron, donate until your ferritin goes between 50 and 100. If you have a high hemoglobin and hematocrit, your ferritin's already less than 100, you don't have a lot of room to donate blood. If you donate too much, now you drop your iron. So again, there's not one specific cookbook heals the exact way. This is the art of medicine. But how do we not pay attention as anti-aging practitioners, longevity practitioners? We don't pay attention to iron that is a big pro-oxidant. So the theory of aging, it's called the free radical theory of aging. And that's what we're talking to John Neal 7, that you try to see, right? How much rusting do you have with all the oxidants that we have, and how much antioxidant your body can make. When we're young, we have a lot of antioxidants. So even if you have a lot of oxidants, it balances it out. You have more antioxidants, so you're young. You want to keep that balance. As we get older, our body makes less antioxidant and we're exposed to more oxidant. So now you have more oxidants, less, and that's aging.
Yeah.
That's what causes aging and cancer, damages your DNA. So yes, so the goal, what we do, we tell people take antioxidants, eat vegetables, take quercetin, take green tea.
Cellular redox to improve the balance of
so you want more
antioxidant.
antioxidant, but what if I can reduce my oxidant also? So if you have high iron, you keep rusting your cells. Yes, I can take rustiolam, anti-rust, antioxidants, but I also want to decrease the amount of oxidants I have in.
Doc, I wanted to just mention this because after you saying this, and before from hearing you, the patient of ours that passed away, was taken care of. I just wanted to show you because I actually went back to his file and looked at the things that he marked. So for those of you listeners, I'm 39 years old. This dearly touched me. It took me a couple of days to actually hit me. Like I don't know. It took me a while to process it, but this man was just 1 year older than me, had 3 kids, and dropped dead on a boat with his kids. And a week later, I get on the system that it's his birthday. So I can imagine what the family had to get reminded of. And look at what he had. This is to give you guys perspective. This was a 40-year-old who saw Doc, who I told him the moment I saw his blood work, I sent him Doc's slide about the ferritin because his level was at 606.
His ferritin level.
Ferritin was, I'm going to read what you're going to see right now. His ferritin was at 606. I told him 3 weeks later, he goes to see Doc. Doc tells him, he puts it off. I don't have time. He's running his businesses and he dropped dead literally 11 weeks before when I had told them between you seeing him was about like 5 weeks. And this is what he put on his forms: mental fog and difficulty concentrating, which is what you're talking about. Decreased energy, weight gain, decreased erections, anxiety and depression. His current medical history was high blood pressure, diabetes, and high cholesterol. He had an A1C of 7, ferritin of 607, glucose of 161, testosterone of 265, vitamin D15, and triglycerides at 175.
So that's a tragic case, and those are the things we don't want to see.
Super sad.
Right? So this is...
But it's a reality. I wanted to bring that up because this is scary. And you told him as a doctor after I had told him, and you told him.
you need intervention.
I thought when he hears it from the doctor, he was going to take some action. He was still, I don't know how real this is.
So this is a typical patient that we're seeing: overweight, diabetic, with
the symptoms
a lot
is
of
what impresses me that you're saying the 3 main currents, he has them.
So a couple of things I want to talk about. For example, there is a condition called dysregulated iron overload syndrome, DIOS. So it is when you have obesity or insulin resistance and your ferritin will be high, because that's an inflammatory response. And a high ferritin causes insulin resistance. So it's a vicious cycle. So a lot of patients I see with high ferritin, it's not, we put them on a diet, we put them on an anti-inflammatory diet, whatever we need to do, GLP-1 tend to do this, or just eating an anti-inflammatory diet. 6 weeks later, and you see their ferritin drop 300 to 400 points. That wasn't just iron, that was inflammation.
Wait, what dropped 300 to 400?
The ferritin.
It can drop that fast?
Because it's in inflammation. So just an anti-inflammatory diet without even donating blood, if it is really just inflammation, can reduce it. So in him, we didn't go further because it never came back to see us.
Losing weight is almost better than donating blood, because I understand that when you donate blood, you drop 30 to 50 points.
But it's two different things. Why do you have high ferritin? Is it because you have high iron? Is it because you have inflammation? Is it a combination of those two? If it's a combination of the two, anti-inflammatory diet, donating blood, then you check your levels again.
So first you would go for the anti-inflammatory diet.
Always.
And then if it's still high, donate blood.
Or both.
Or both, if necessary. I mean, that's where your art and magic comes in. That's why you're doc.
And we don't have a lot of time left. We have to talk about what do you do when you find.
That's what I was going to ask.
And blood donation is one of the most important things. Again, you were asking, was there a natural blood donation? Those are called leeches. In the 18th century, in 1700, the way they treated patients, they put leeches on them because they remove the bad blood, they remove the iron. So what we tell our patients, if your ferritin is not at functional goal, and studies have shown that functional ferritin should be between 50 and 100. For men, we want it at about 80. For women, at about 50.
That's where I'm at.
So that's
80.
functional level.
ferritin?
Yeah.
Ferritin should be at about
80 in women,
for,
50
80 for men,
80 for
about
men,
40
50
to 50
40
for,
50
for
women.
men. So basically, I want it below 100.
Yeah.
So if
But
you don't
what do
have
you
those
want
levels,
low is what for you? Low would be what?
below 30.
Below 30.
Below 30, now
Okay.
you have
That means
iron
that you're either
deficiency.
you're either
You're iron
donating too
deficiency.
much or you have losing blood from
really
somewhere.
quick, we found a patient that had a ferritin of 20. We sent him to do a colonoscopy, and it was colon cancer.
Yeah.
So ferritin, we need to know it, whether it's low or high.
Or you could have
we
a
need to
hemorrhoid
know.
and have
a
low
hemorrhoid.
ferritin.
You can have a polyp.
Yeah.
You can have an ulcer that's slowly bleeding. So ferritin gives you a lot of information,
A lot of value.
But for our patients, and when you think about it, 90% of the patients that we see have a ferritin between 200 and 400.
Yeah.
It doesn't say high on their blood test,
Right.
because the upper limit of normal is 400.
400.
What should those patients do? Again, we have studies, long-term studies, that show that the functional range to be about 80. So what do you do if you have a 200? You have no symptoms. Now you're on testosterone. You feel better. You're eating better. They're like, why do I care about a ferritin of 200? Because it affects your longevity. Between 200 and 400, the median age was 72 versus 79 when you have it below 200. So a patient that has a ferritin above 100, you should mitigate this.
Yes.
Start eating less iron. And
So
I'm
throw
all
away your
for carnivore.
throw away your multivitamins
Yes.
that say added iron.
Less carbs, because we got a lot of iron
Fortified-
from carbs.
fortified iron
Fortified
for food.
iron
Right.
foods. And start taking supplements, the antioxidants, things like quercetin, things like green tea, black tea. If you sip tea while you're eating, you have less iron absorption. There's another supplement called IP6 that blocks the iron. So you want to decrease your iron absorption. You want to increase your antioxidants, and you want to donate blood.
I just
and
feel like the donate blood is just the best way to
No,
go. You're
you
helping,
do
saving
all-
a
you do
life,
all. You do all.
and you're helping yourself.
So donating blood is so important because keeping that level at about less than 100 shows benefits for longevity. And when you donate blood, there's multiple studies that show that blood donors on average live longer than non-blood donors.
Oh, really?
And not only because there's a bias, because people who donate blood tend to be healthy. If you're unhealthy, they won't let you donate blood. But they've done studies on people who donate blood maybe every 3 years versus people who donate blood every year. They've seen less cancer, less heart disease, less dementia, and longer life.
That's awesome.
So why wouldn't you want to know that number?
I think that also has
let me
to-
finish
yeah.
that point. Why wouldn't you want to know that number? Follow that number, not just once. Follow it throughout the years, and then either donate blood or eat less iron to keep it in the functional range.
I think that just the magic of this, what we don't know, that the blood donation, your body having to rebuild that blood.
Yeah.
All the other components
So
that are in
hermetic
there and
stress.
getting rid of all the other toxins that we carry is just healthy for
And
overall health.
donating blood, I mean, short of you not being on testosterone, like if you donate blood once or twice a year, it's so healthy for you. It's so
So
good for
if you look at almost
free ticket
every
too.
longevity protocol that's out there,
you
they will say donate
You used to
blood.
get a free movie ticket.
Guys, have
don't
you
do that
seen that?
anymore?
No.
No, I get a $20.
No, now they give you some
$20.
Doritos.
No, I get a $20 gift card.
yeah?
Give it to my kids.
So you
I
have
get
you have a great
t-shirt.
saying with the blood donation.
What is it?
Come on.
Donate blood, save your life,
Save somebody else's, save someone's life.
Come on, dog, you forgot
and
your own
save-
quote, bro.
Save your life.
and save
Your
your
cheesy
life.
quotes.
So for you guys, I love cheesy
Yeah, I
quotes.
know, I
man.
know, I know.
And as you
I
were
like 'em,
saying,
I like 'em some.
Every time I donate blood about 2 to 3 times a year, my ferritin stayed about 50 to 80.
Yeah.
And when you check your ferritin within the first 6 to 8 weeks of donating blood, it's going to be low. You want to check it out about 3 months.
Yeah.
But you want to measure that. Every time I go and donate blood, that's my selfless day.
Yeah.
I sit down and I donate blood and I'm like, I'm saving her life when I'm also helping myself.
But you just said something important. When you donate blood, wait a couple weeks before you test to
At
check.
least 6 to 8 weeks,
Yeah.
because your ferritin level is going to stay low. And then, because when you donate blood, you get the
important
iron
to know.
out, and then your body's kind of going to replenish, going to
Yeah.
get it out of your liver, the tissue.
Oh, it's going to
and
release it
bring
from all
back.
the other deposits
Exactly.
into the
So
system.
it takes time for it to get there. So by the
and
second
that's
month,
really, it's kind of like we wait for patients 6 weeks before we test their blood on
Exactly.
testosterone.
Yeah.
Here, you got to wait 6 weeks. Rule
Yeah.
thumb.
6
on
to
a
8 weeks, yeah.
6 to 8 weeks to
Then you
check the
check
real
your ferritin.
ferritin level.
Yes.
I did not know that. That's
So
really
again,
important to know.
and you know, one thing that I have,
Wow.
why aren't anti-aging doctors, functional medicine doctors talking about this, because it's such an important part. It's not the only thing, but if you're doing everything right already, iron management needs to be a part of anti-aging management. And I thought, why aren't they talking about this? It's a pretty recent thing. They only found out about the HFE, the hemochromatosis gene, in the mid-90s. Yeah. They only found out about hepcidin in 2012.
Wow.
So they've
That's
only
super
found
recent.
out about ferrotoxic disease the past 20 to 30 years.
That's
when I
brand
went
new.
to medical school, they always told me, hemochromatosis is very rare. Worry about iron deficiency. Yeah. We never talked about iron overload. Yeah. So there's a whole blindness to the anti-aging world that refuses to talk about ferritin.
I mean, you're more proficient at this than most hematologists. Which
My
is,
hematologist that I sent to
the Iron Terminator.
That's a new one. All right. Well, listen,
I
Doc. I mean, look,
enough.
for anybody listening, just remember, check your ferritin number. Really
Check
important to
your
know.
ferritin.
If you see that it's high, donate blood and wait about 6 weeks. You want the levels to be literally under 100. But if you want more information and if you want to be seen by Dr. Rudy, who is an iron specialist, please give us a call. Obviously,
Aside from other things.
Aside from a lot of other things. But yeah, we hope that you gained a lot from this podcast and that you learned at least a new technique to how to think about your longevity and what kind of markers you should ask your doctor to really draw if he hasn't drawn those. So thank you so much for listening. Please share us, follow us, like us, do all that mess.
Share us.
And we'll see you on the next episode. Until then, stay healthy.
God bless.